Hey everybody, it's Sovey with HealthyConsumer.com, and in the next 5 minutes we're going to explore what causes sinusitis, or commonly known as sinus infections. We're also going to look at hay fever, commonly known as seasonal allergies, what causes them, and what can we do to stop them or at the very least reduce them. So it's the end of October here in Michigan, and it's kind of that time of year for a lot of people that tends to be really dreadful. And I think in my past, that is very much true. I mean, I've suffered for a long time with seasonal allergies and chronic sinus infections, one of which lasted for almost 8 months. It was an incredible ordeal for me, and I learned a lot about my body during that time. Growing up, I went through the traditional medical approach of treating allergies, both with antibiotics, which obviously we know now are very overprescribed in a lot of different cases for things such as sinusitis, and then going through immunotherapy, which are just the regular injections for allergies. And so I just want to start out by saying that this is not a substitute for medical treatment, and I don't want you to stop your current treatments. This is just things that I've experienced myself and based on my own research, but always consult with your doctor first. So we want to clarify real quick, what is the difference between hay fever and sinusitis? And so hay fever being seasonal allergies, and then sinusitis being an actual inflammation of the sinuses and usually infected as well. Sometimes this sinusitis develops into a chronic state where it lasts for a long time and people have to go in and out of antibiotics over and over, or even steroids, and it can be very troublesome and very debilitating. And then I think there's a crossover between that and what goes into food allergies as well. I think there's a huge correlation between the two, which I've seen in my own research. I think that going through all the things of like the Z-Paks, azithromycin, and going into immunotherapy, finding that it didn't work in the traditional antigen-antibody response, I found that didn't work for me. And so one question I think we always have to ask with any treatment, whether it's natural or whether it's a traditional Western medicine approach, is why are we doing it? When you see someone and they tell you that your allergies or anything that you're suffering from is idiopathic, that typically essentially just means that the practitioner you're working with has no idea what's causing it. They don't have the skills to tell you that, or there's just not enough research to determine that. So I think, just in a real quick nutshell, I'm going to approach allergies with a very different point of view than a lot of people are. Instead of doing shots and pills, which I went through for so long, we got to look at the histamine response. And why does your body do that? Is there an underlying autoimmune component to it? Is your gut flora imbalanced? Are there other weaknesses in your immune system? And these are all things that we need to consider heavily when we're trying to figure out what's the best treatment approach. I don't think that we have to be doomed to our current state of allergies, whether it's food, whether it's seasonal, whether it be any sort of allergic reaction. I think we can always explore that at a deeper level. It just depends on your level of curiosity and the time that you want to dedicate to yourself. So we always have to ask ourselves, what do we want to accomplish in our treatments, and how are we going to get there? So I think one of the best ways to approach this in a lot of cases is to explore some of these underlying causes. Maybe look at restoring your gut flora imbalance. If you were on a lot of antibiotics or other risk factors for that, the gut flora travels throughout every mucosal surface in your body. So if you have chronic yeast infections or things of that nature, there's going to be a relationship to allergies as well. So we want to look at things like probiotics, fermented foods, and yes, even the controversial gluten. There's a lot of research both ways, but I think it's something worth exploring. It's definitely not going to hurt you to try that. Think of oral hygiene and nasal hygiene almost as the same thing. If you brush your teeth every day, why would you not want to also keep the nasal cavity clean as well? So look at some of my videos on the Sinupulse. That's another great thing that you can do. In regards to probiotics, I have a very detailed step-by-step video out there on the net on how to make homemade probiotics. So check that out in the description below. And take out the guesswork of everything. Stop eating crap food and just start eating an organic whole foods diet. Pay now or pay later. And be sure to subscribe to my channel below for more information like this in the future, and visit healthyconsumer.com. Thanks a lot, and blessings to your health. Have a great day.